Welcome to the Long-Term Care Chronicles podcast.
Thank you for coming on to the Long-Term Care Chronicles to speak in regards to family councils. So before we start, can I just get you to tell us about yourself and about the Vancouver Island Association of Family Councils?
Well, my own entry into this world was through my mother. She developed Alzheimer's and so on, and so we went through that agony of trying to figure out what best way to manage and so on, and we ended up inevitably, because my dad passed away around that time as well, having to take her into long-term care, at the advice of doctors and so on. And when I went to the facility, it was a gorgeous building, beautiful furniture, and there were gardens everywhere and all this kind of thing. And so the guilt and the worry that I was feeling, I was learning how to manage that, first of all. And then I got to know a few of the staff, and they were wonderful. And so I convinced myself that, well, this is going to work. But then what happened, once you get inside, I thought, well, to give you an example, the same staff that, I thought were just so wonderful, well, I'd have new people showing up, and I found myself keep having to explain, my mom's situation, what to watch for and all this kind of thing. So there's staffing instability. And the gardens couldn't be walked through by residents because there weren't staff to make them do it safely and all this kind of thing. And then I got to fast forward a little bit later, and the entire healthcare staff was fired 3 times in 4 years, through contract flipping. And so we lost complete continuity of care and, staffing shortages and et cetera, et cetera. So during that process, I had heard about family councils because I wanted to have a voice in what was going on, as did other people. And so we started up a family council and worked hard to try to get our voice heard. And to the company's credit, they stopped. We were pressuring them to stop this contract flipping and so on. They did that, but there were other issues and so on that carried on. And so then I thought, well, you know what? There are systemic problems here. It's not that particular facility. It's ingrained in the system. And so what I did was I connected with like-minded folks in Victoria. And we got together and we decided that there would be a value in having the ability to have a systemic look at long-term care, to find out how many perceptions and experiences are being shared, throughout our health authority. And I think there were probably only about 5 or 6 of us individuals who were starting this thing out. Fast forward later, we developed our terms of reference, our goals, our philosophy, and so on. And now we have a collection of family councils through, I think, 13 different municipalities on Vancouver Island now. And so what that does is it gives us the opportunity and the ability to instantly determine what's working well systemically in long-term care and what's not working well. And I remember perhaps naively thinking, well, we're going to be a tremendous asset, for the health authority and for the Ministry of Health to, give them feedback, to tell them what it is that we are seeing as canaries in the coal mine kind of thing. Turned out that especially the previous government, they weren't terribly interested in, our opinions, our feedback, because sometimes the feedback provided kind of inconvenient realities, brought them to the light of day. So anyhow, now we have the Vancouver Island Association of Family Councils, and we've been contacted by other councils in other health authorities who are interested in doing the same kind of thing, but it's tough slogging without support and help from the Ministry of Health.
Thank you for that. And so what other organizations then you have, or family councils that you have worked with, trying to establish, and as well with the local health team?
In terms of our advocacy efforts?
Yes, your advocate. Yes, the advocacy
Well,
efforts.
you know what, it's when you have the general public, they hear about, you know, say our efforts and so on, but they don't know what situations are until they experience it personally. And so currently we have you know, all kinds of care catastrophes that are going on because of COVID, but they're because of things that we've been worrying about for years. And so now, because it's you know, hit the headlines and so on, there are different groups sort of emerging in different ways, and we're all starting to talk to each other. But that speaks to what I think is one of the fundamental problems of the system. When I look at long-term care, and we've examined across Canada, and it's similar in other jurisdictions as well, long-term care has kind of a system where it's a bilateral partnership between governments and people supplying the care, you know, and many of them are for-profit facilities. And the people who should be in there are almost systemically excluded. And that's the very people that are sending folks into long-term care. And you have to remember too that one of the things that we saw happening was that the acuity level in long-term care, the level of medical need has gone up and up and up in long-term care, because what's happened, I'll just use BC as an example, is higher functioning residents who could advocate for themselves have been moved into assisted living, and there's more home care services and so on. So what you're left with is people who are, you know, one of the most vulnerable groups in the province, because they're largely unable to advocate for themselves. And so in that kind of setting, then you need friends and you know, family and other persons of importance to them to have a voice in decisions that are being made in long-term care. And that currently is not happening. In fact, quite the opposite. We're getting a lot of pushback, you know, from the industry. And we had pushback from the previous government. We've had expressions of interest in the current government out here, but still no action on it. Does that make sense?
Yeah, absolutely. And I know that back in, I think it was 2014, 2015, your group identified some major roadblocks in terms of supporting residents, and that was primarily the marginalization of family councils, as well as staffing stability. And what were your recommendations at the time? And with these two roadblocks, obviously, this is now coming to pass during the pandemic.
Mm-hmm. You know, I spoke about the bilateral kind of arrangement that exists now. It was a number of years ago. Daryl Plekas, who was the previous government's parliamentary secretary for seniors, he released this document that was created by the industry and by the Ministry of Health. And they were talking about staffing concerns. And so the document crossed, you know, our vision of sight, and I looked at it, and so I sent a note to them saying, look, had you asked us, we would have identified these staffing issues as well. And it had to do with instabilities that were creating, you know, loss of continuity of care, staff shortages, and a lot of people in casualties and so on. And we came up with 4 or 5 really, really important things that weren't even on their radar. But we were not invited to that conversation, and we were not invited to the planning, you know, moving forward and so on. So that's an example of one thing that's come back to haunt us now. And I can tell you too that it was in May of this year, we sent a note to Minister Dix, and we were talking about our concern about staffing issues, instabilities and shortages, and practices like having staff travel from one facility to another. And we were cautioning him about that, but we'd been doing that for years too. But in BC, nobody is required to listen to us. So those things go back, a long time. And I was telling you earlier, I think that we've made a proposal to change all of that to guarantee family members to have a voice in decisions that are being made in terms of policy and in terms of service delivery in each facility. And everybody in the current health authority expresses a lot of interest in our ideas, and some really good ideas. In fact, we had the parliamentary secretary for seniors of the current government say, what you're saying is right. We are going to recommend it to Minister Dix for implementation. And that was quite a while ago now, and still we have nothing. So.
Yeah, just one of those many challenges, but it's just interesting that your research revealed that many years ago prior to the pandemic, that would still be an outstanding and important issue at this time. Now, going to the pandemic, like with the family members, the essential caregivers, for the most part, have been pretty much locked out. And many family members have been very frustrated at the lack of communication from the facility as to what's happening, how the vaccination rollout is going. How valuable would it have been for at least family councils to be established in a lot of these facilities, and for family councils to be legislated by the provincial government and to be used as communication avenues for these facilities?
Oh, tremendously valuable. When people go into long-term care, there's a huge learning curve for family members, and friends and so on, who are accompanying them, who are trying to advocate for them. And, truthfully, what happens, unless they have something like a family council to say, look, these are your rights, these are your opportunities, here are some good ideas for you to consider trying to promote in your facility and so on. They figure things out just about the time that their loved one is dying. And then you have a whole new batch of people and so on. So that's one of the things that a family council can do. You mentioned the COVID situation and the visiting. This is another unhappy truth, that in June, the Ministry of Health and BC Care Providers Association had engaged in a partnership to do something called Equip Care. And what it was a system of targeted funding that they were making available to facilities to make sure that things were safe from the virus point of view for residents in care. Okay, so the letter that we sent to Minister Dix was that, look, if you had asked us, what we would have said as well is make sure that there's funding to have protocols in place so that you can have safe visits. One of the reasons is that many of these family caregivers are essential. They're not visitors, they're caregivers, because they've been in the practice of helping feed and providing exercise and everything else. But they were completely excluded in the discussion. And you look at the cost now, there's a legitimate perception that keeping family members out of there is an act of cruelty. And it's not happening to strangers. It's happening to people's wives and husbands and fathers and friends and so on. And it just makes no sense that that the collective community voice would be excluded still. So that's why we're still pushing very hard to make that happen, but not yet.
It's still, I guess, a work in progress. And the other thing that you mentioned, that with family members, sometimes, their loved ones do pass on, but they still want to participate within the family council. Do you have anything in terms of with your terms of reference that will still allow someone to still be part of family councils?
I'm glad you mentioned that, actually, because my own mother passed away a number of years ago now. But it's such an important community issue, and I've got a lot of friends who, have somebody in care. So, I'm a pretty good resource for them because I've been there. I know how the thing works and so on. I can provide them with, important advice. It's the timing of your question is interesting, because yesterday I got a message from somebody in Fraser Health. And she was the chair of the council, and she just an amazing woman, just a heart as big as a room, and smart. And she did all the right things as chair of the family council. What she tried to do was to, as is a goal of every family council, you want to build partnerships with the staff and with management, so collectively you can look for the best way to find quality of care within resources that are available. You want to have that voice in there. And she had that approach and so on, but there's always pushback. In fact, in that facility, the manager wanted to run all those meetings instead of a family member. Unhappily, her loved one died. And so now there's been a quick move on the part of management to say, well, you're out of here. Okay? And there's not a single reason why that would be good for all the residents in the facility. But there may be a reason why it's convenient for management, and that's the awful part of it. I can give you another dramatic example. Excuse me. Here on the island, we had a facility in Central Island and a facility in the North Island. The one in the Central Island, there were all kinds of pretty serious care issues going on. And there was an independent family council there who was bringing those care issues, care concerns, to the attention of the health authority. And there was another family group in the North Island who was meeting off-site because the facility manager up there wanted to run the meetings. They didn't want that to happen. And part of it is because, family members fear reprisal. Generally, they're afraid to complain. And if you have private discussions where you can identify strengths, but also find out things that you think are wrong, that's a place to have them. Anyhow, what happened in those facilities was finally Island Health got involved, and they had a look at what was going on, and they took over operation of 3 of the company's facilities on the island alone, and they ran it for about 3 months. And one of the interesting outcomes of that was that a senior official in Island Health commented that to the family council that was meeting offsite, saying, if we had seen minutes of these meetings that you had a year ago, we would have stepped in then. Okay. They were almost had to meet offsite, they thought. Okay. Fast forward, the operation of the facilities is returned to the company. And within days, I got a call from the facility in the Central Island saying, look, here's what's going on. The facility has given us brand new terms of reference to replace the terms of reference that were written by the family members. And they also wanted to appoint a facility person as a chairperson of the family council. And so the obvious reaction was that, so that means that agendas, discussion, recommendations have to be filtered through a company appointed chairperson and a company made terms of reference and so on. And we've brought that to the attention of the Ministry of Health, and we still haven't heard back from them. So, in a letter that was maybe a little more bluntly worded, said it makes you look complicit in the efforts to silence what it is that family members want. So by not acting on it, by not guaranteeing through regulation that facilities can't do that. You're in Ontario, right?
Yes, that's correct.
Okay, so in Ontario, you'd be aware that you have a network of family councils and a provincial body that supports the operation of family councils and so on. And that's the kind of thing that should be all across Canada. There's a group in Nova Scotia who I've been chatting with who want to do that. There's a group in Alberta who want that to happen. And in both of those provinces, they have absolute guarantees that the family voice will be included in decisions that are being made in long-term care. Not in BC right now. And that's what we're pushing for here.
So, and that's the importance of making sure that family councils is legislated by the government. Because you did mention as well the family reprisals in terms of not speaking up to, that's a big one, because family members are always afraid of what will happen once they do speak up. That's so right. they just prefer, they would just prefer to say, I had a good visit type of thing. And can you just speak to us to what the importance of of ensuring that family councils it's legislated?
Well, first of all, it's not just an anecdotal kind of perception of what you're describing. There's plenty of research to show that family members do worry about that very thing, and a lot of it is not necessarily rational, but sometimes it is, but nevertheless it's real, and it's not good for residents. There's abundant research to show too that having the family council voice in long-term care improves quality of life for residents. And but that needs to be legislated. To be honest, in BC, we have about 3 lines that say facilities must provide family members the opportunity to form a council once a year. Well, I didn't even know what a council was when I went into long-term care. And so who does that? And in Alberta and in Ontario, they say it has to be independent. Managers are only attending meetings by invitation, which we encourage them to do all the time anyhow. You want to work with management teams and so on. And so on, and so that's a really necessary first start, but the cost is always at the expense of residents when those things don't happen. So.
Yeah, because currently right now in the province of British Columbia, the family councils is just set in the residential care regulations, is that correct? And as you mentioned, it just has a couple of liners, but because the family councils doesn't have any I guess you could say teeth, so to speak, it's hard for them to obtain information from the operator. Let's say if they had a complaint and wanted to formally put that through, there's no guidelines as to, yes, you need to respond back in 10 business days or 10 days to your complaint and to further assist to get changes to be made within that particular facility.
I'll give you another example of what it is that I'm talking about. We had one of our councils was noticing that care aides, and they're the frontline people who spend most of the time with residents. They seem to be used extraordinarily for doing things other than work with residents personally. And so they asked questions about, well, how does that work? Like, how many hours per resident? How do you report on that? And how's it monitored? And the same council was meeting offsite because, by the way, previous manager wouldn't advertise their meetings, okay, and quite legally able to do that. And what they discovered was that that did seem to be happening. They took it to Island Health, and I have the email. Island Health's reply was, well, that's not really the responsibility of a family council to look into, hours per resident day. That's our job. They kept pushing it. And in BC, and this is one of the things that our seniors advocate brought to light, it's self-reporting on how staff are allocated. It turned out that, yes, these reports were inaccurate. And in the meantime, thousands of direct care hours were not received by residents. And so the facility was instructed to report in this other kind of way, more accurately. But the problem was 4 years went by before it came to that point. And we've brought that to the attention of our Ministry of Health as well. Now, what cost to residents? And that's an example of the outrageous kind of thing that can happen if you don't give family members a voice in decisions that are being made. And the decisions, by the way, are not just in facilities, but decisions that are being made in health authorities, and more importantly, in Ministry of Health policy.
Yeah, because in November 2020, in the report by the BC Seniors Advocate, the Staying Apart, Staying Safe, she mentioned about the family councils, that they're unique to each facility, but they have no collective voice at the health authority level or even at the provincial level. And it was her recommendation to have a long-term care and assisted living resident and family council association, indicating that this was very important, especially in this particular pandemic. But there was no timeline that was given. So how effective is that in terms of a recommendation being made, but then there's no timeline given as to when that needs to be enacted for?
Well, that's the frustrating part of trying to move things through government. Everybody has expressed an interest in the idea, and yeah, it makes a lot of sense, and it seems to be lost somewhere in the bureaucratic jungle, and it just hasn't been a priority. And surely now it will be, surely. And we've often thought that if you look at other vulnerable, marginalized, suffering communities across Canada, if you've got a government that wants to make things better, well, surely those very people are the ones that you should include in finding a solution that's going to work. And it happens everywhere except in long-term care. And that's what needs to change. In fact, I mentioned folks that I've been talking to across Canada. That's one thing that's been on our radar in terms of federal kind of reaction to the long-term care issue now, is that we're going to try our best to insert ourselves in that conversation somehow, because it should happen if we want the best possible outcome.
I definitely agree with you there. And so then how do people then get involved to make sure that this does become on the radar for the government, and to make sure that they enact this? Like, what do people need to do to get involved to get this done?
You know what, recently we had a little letter writing campaign to send our message again to the Ministry of Health and to all the parts therein. And I think that's what has to happen. I think we need to, in our case in BC, tell Minister Dix, look, we've got to do a lot better than this. People are suffering, and the COVID thing has exposed all the weaknesses in long-term care. And we watch, across Canada, we've looked at best possible practices, and The unhappy truth is that long-term care seems to lurch from one crisis to another. Enough is enough. And we even looked at Ontario. They've got the model of the family council organization there, and they're doing their part. But then over the last few years, as I'm sure you would know, that the provincial government stopped inspecting these facilities. We had a look at in 2015 to 2017, the vast majority of facilities were being inspected every year, and these are comprehensive inspections. And then in 2018, the government decided to cut those in half. And in 2019, out of well over 200 facilities, I think it was only 9 facilities that had a comprehensive inspection. So that's the reason for the crises that we've witnessed in Ontario. It's not family members, they can only do so much, but all those parts need to be engaged together in order to make the thing work. And these people who are in long-term care, I mean, these are people who built the country. It feels like such a betrayal not to do everything that we can to provide the best possible service in long-term care. And let's not forget, we've got an aging population. I have no plans to go into one of these places, but we've got an aging population, a tsunami of seniors, so we've got to start getting this right. And that begins by listening to groups like family councils.
Absolutely, I definitely agree, because it's only going to be more and more as time goes on. And the fact that long-term care, since pretty much the beginning of this pandemic, has been in the conversation piece across the country from day one. And would you agree that family councils needs to be part of this whole national standards that they're talking about, and needs to be an actual stakeholder and part of that conversation, and as well to be a voice that we need to be listened to at that type of federal level, that not just the doctors, whatever other organizations or that you're going to be speaking with in terms of developing these national standards, but you need to look to the family councils and make sure that that is enacted across all provinces across this country.
Absolutely. And, it's not like this is something new. I'm a retired teacher, and in BC, we have parent advisory councils in every single school in the province. And the reason those things are there is that parents in communities wanted to have a voice in some of the decisions that are being made in schools. And then there's a provincial organization that has a direct connection, of course, to the Ministry of Education. And that's the kind of thing that we're after in long-term care. And it should happen. It should be ingrained in the operation of these facilities. And sometimes we're cheeky. We pointed out within the Ministry of Health, they have embedded in things like health authorities the opportunity for groups, concerned kind of employees to have conversations about what it is that they're concerned about outside of the earshot of their bosses, and they have those things in place. Put them in place for long-term care. My God, if there's ever a need for it, it's there.
Definitely, and thank you. I just wanted to say thank you so much for coming on to the Long-Term Care Chronicles.
Very welcome. Thanks for the opportunity.
Oh, you are most welcome. Thank you.